Let's now introduce Dr. Clay Hayes, who is back, our chair of the Mississippi Healthcare Solutions Institute, who will lead our panel in their discussion, and then we'll be on to a great and inspiring lunch with Dr. Hannah Gay and a really in-depth remarks from our Governor, Phil Bryant. So, Dr. Hayes, take us away.
Our second panel will focus on the Mississippi success. We've seen the national perspective, and now we want to focus on the Mississippi success. As momentum is building for this exciting opportunity, it's very important that we highlight things that are already taking place. Our panelists this morning include Dr. Richard deShazo from University of Mississippi Medical Center, Edmund Hughes of Ingalls Shipbuilding, Dr. James N. Turner of William Carey College, and Gerald Wages of North Mississippi Medical Center. And our first presenter today will be Dr. Rick deShazo, a Billy S. Guyton Distinguished Professor of Medicine and Pediatrics at the University of Mississippi Medical Center. He's the former chair of the Department of Medicine at the University of South Alabama and the University Medical Center. He received his MD at the University of Alabama at Birmingham School of Medicine. Please welcome Rick deShazo. Thank you, Rick.
Hello, Mississippi. It's good to be here. And I feel really at home because I've heard from folks from UAB and all these places I've worked. But you know, I'm not sure if any of those folks know Who's Your Mama? And because Who's Your Mama is who we are in Mississippi, we care about Who's Your Mama. That resource is a resource they don't have in Alabama, my home state. They don't have in Texas. They don't have a lot of places. It's the heart of our people that will make us change and move forward. And I want to show you a few examples of how groups have worked together to begin to make change in Mississippi, and that some of these the university's been a part of, but many of these have been local efforts. Now, I think as you see in this slide that things have changed in Mississippi over the last 50 years. Our kids look very different than they did 50 years ago. The big question is, are they healthier than they were 50 years ago? And unfortunately, they're not. This is the first generation of Mississippians that will live shorter lifespans than their parents. It's not just in Mississippi, it's across the Southeast where we have this epidemic of bad health. We've made real progress lately in Mississippi. If you look at that graph up there on the right, you see that our obesity rate, which is the highest in the United States, has improved, but you also see that the lower lines are African Americans and the higher lines are Caucasians. So the reason our rates have gotten better is because we have one segment of our population that has improvements and health disparities that are affecting another part of our population that hasn't. But in looking at why these health disparities and why these health problems exist in our state occur, it's very easy to simplify these as many folks do by saying, well, we just eat too much and walk too little. But in Mississippi, as is the case in most of the Gulf South, it's much more complex than that. The factors that have gotten us into the fix that we're in are all closely interrelated and complex. And there's not one particular factor that will fix the problem for us. The thing that will fix the problem is an integrated approach to addressing all these problems simultaneously in partnerships. And there are a number of partnerships that are already very active in our state. You'll be hearing from a number of them on this panel today. If you're interested in looking at this list, they'll be online in the program proceedings from today's programs. But you've heard many of these efforts that have tried to address issues in health literacy, our geographic disparities in the state, our poverty situation, systems of care, and so forth. There are a lot of these out there working very effectively. The one that I think that is the most productive of all is the Mississippi Students Act, which, with the support of the Bauer Foundation, made tremendous initial accomplishments and is due for some additional support. Let me focus in my brief visit with you today on some of the things that we've done at the University of Mississippi Medical Center, not because they're the best, but because I know them the best, and they're examples of partnerships that can occur among people who are otherwise seen as competitors. And the first one I'd like to call your attention to is the one up here on the right, which says healthy living. Several years ago, we realized that there was no way that we were going to address our issues of health literacy, that is an understanding of basic biology and how it affects healthy choices in our state, without mass communications, and that we need to coordinate our educational efforts with our media efforts. And we went to public broadcasting and we said, look, we need some innovative ways to begin to address some of our health issues. And they said, we've got 9 different transmitters that reach every square foot of Mississippi, and it's just like the Pope. There's one transmitter in Jackson that generates all the information. We don't have a lot of mixed messages. You can put one message out there. So we started this thing called Southern Remedy, and from that we have had about 8 years of data collection. And I think we're beginning to see that we're beginning to move the needle a little bit so far as a basic understanding of things like immunizations, preventive medicine, you've heard a lot about, the importance of follow-up for chronic disease, and where the health resources are in the state. That has now expanded to a, to a television effort, and we now have had about 20 hours of TV production looking at Mississippi's health problems, and we're moving forward to expand that further. So there's a partnership between 2 state agencies and a lot of supporters of those agencies that seems to be working. The partnership down here, that's this picture of the state of Mississippi, has to do with the telemedicine program. That is a program that is partnered with every critical access hospital in the state. These are private hospitals or public hospitals to provide emergency services to areas that do not have fully 24/7 staffed emergency rooms. And so our emergency room and the physicians there who are available 24/7 in significant numbers are able to resource the physicians, nurse practitioners, and others who are available in those areas and provide a system of care, a coordination of care that you've heard about for the ones who need to come to the medical center or to another medical center with a higher level of care expeditiously. They're now also doing specialty services, and educational options are also being provided for health professionals through this system. And the third one up there on the top is one that I am very excited about as a Methodist. You know, Methodists think they know everything about everything. And that is our Community Health Advocate Program. We have just signed an agreement with the Mississippi Conference of the United Methodist Church to train a community health advocate for every Methodist church in the state. And these people will be certified to take blood pressures, measure blood glucoses, give basic dietary counseling, provide coordination of care, and identify health resources in the area for all of these Methodist churches in the state. The average size of a Methodist church in the state is 30. So we're talking about getting into rural areas, and through the foresight of our Vice Chancellor, we now have enforced a regulation that every one of our graduates at the medical center now has to have a service learning component, documented service learning component before they can graduate. So they'll all be being trained as trainers to go out to all these Methodist churches and hopefully Episcopals and Catholics and Baptists and all the rest after that, to train these local resource lay people in these churches to begin to help folks do preventive medicine at the ground level. So there are three particular areas that we're partnering with, and you'll hear many more about other similar efforts as we go forward. What does this have to do with business? It has everything to do with business. The downstream payoffs for improvements in health are very, very clear to anyone who has ever made payroll. It has to do with profits and productivity, and it has to do with decreases in absenteeism, disability payments, and presenteeism, which is a big, big problem in business when you have a chronically ill workforce. I think that the real answer, and the thing the governor has pointed out over and over again in all of his efforts in this area, is partnerships and a switch from a focus on disease treatment to disease prevention. And my mama says we can do it. Thank you.